Hello, my name is Byrne, and today I'll be sharing our findings on identity-specific needs in Lane County LGBTQ youth in partnership with Dr. Mariah Kornblue and Dr. Sherry Bell in the Department of Psychology at the University of Oregon. Before exploring our research, I would like to share a little bit of background information to help visualize some key findings. LGBTQ youth are subject to discrimination due to homophobic and transphobic prejudice, putting this population at risk of negative identity-based lived experiences. Of this population, an upward trend of mental health disparities has been observed in LGBTQ youth when social support is unavailable. If you take a look at this chart provided by the Trevor Project, you can see the steady increase in symptoms of anxiety, depression, and considered and attempted suicide in LGBTQ youth over the years. Identities within the LGBTQ population differ. Therefore, it is probable to assume different needs arise within this community. For example, gender affirming care. Transgender and gender diverse, or TGD, youth face harmful policies within the United States' current political climate. As you can see, this map provided by the American Civil Liberties Union shows the anti-LGBTQ bills per state that have either been proposed or passed in 2023, with the darker states indicating more bills than other states. Now more than ever, LGBTQ youth need our help to find support within the community. The current study asked the following research questions. What are the social emotional needs of Lane County LGBTQ youth? And what are the differing needs of gender diverse individuals compared to those with diverse sexual orientations in Lane County? By conducting a community-based needs assessment with local nonprofit organization TransPonder, we have been able to start observing identity-specific needs within the community. As for the methods of this study, participants consisted of 2 focus groups for a total of 4 participants. Ages ranged from 14 to 24, and recruitment took place through physical flyers, social media, and TransPonder's website. Each participant was compensated with a $25 gift card for an hour of their time. During data collection, researchers asked semi-structured interview questions directed towards focus group members, such as, what aspects of your identity are you looking to connect around with your peers? As for our procedure, we first recruited possible participants, then obtained a signed waiver of consent. Parental consent was not needed. Researchers and participants then met in a disclosed space within Lane County and recorded focus group sessions. Recordings were de-identified in analysis. We then took a thematic analysis approach in order to find themes within our transcriptions. By using a dual coding technique, 2 researchers generated a codebook and found 6 emerging themes. These themes are youth needs, activities, macro-level influences, policy and politics, social support, accessibility, facilitators and barriers, and online advantages and disadvantages. For youth needs, youth express ideas concerning representation, resources, and spaces related to identity. Youth are interested in transponder events that speak to their needs. Some identities that were mentioned were race, neurodivergence, gender identity, and age. For activities, youth shared with us the activities that they have recently participated in. These activities included yoga, trivia, beauty workshops, and pride. As for macro-level influences, on the policy level, youth have discussed how social injustices systemic barriers influence how they experience education in the county. These included uneducated professionals, such as healthcare providers and teachers, unpunished harassment in school settings by peers, and non-binary exclusivity when learning about gender diversity in school textbooks. On the political level, youth express that tensions around LGBTQ rights and history surfaced in the classroom, and they don't have the opportunity to explore their identity in what is supposed to be a safe space. This happened when discussing an interest in LGBTQ history, given this information is not available to youth in school settings. Additionally, youth felt dismissed at events due to their age. and have experienced harmful comments coming from others. For social support, youth have experienced positive outcomes from attending TransPonder events, benefiting their social emotional development. These youth commented how they felt vulnerable enough to share their similar lived experiences so they may connect with others. These spaces provided a healthy channel for negative emotions related to discrimination. For accessibility, in terms of facilitators, youth have expressed what is helpful for attending TransPonder events. These included outreach in high traffic areas, creating more publicity for events, and having parking availability at events and venues. As for challenges to access, youth have discussed barriers they encounter when trying to access local activities. These barriers include the location of events, accessibility using public transportation, experiencing time constraints due to schedule conflicts, and financial stress of attending events. For online advantages and disadvantages, youth found that online outreach was an effective form of advertising upcoming events. However, youth found that hosting events online to be a disadvantage for online utilization. They commented that they felt like others could listen in on their conversations if they attended online events, thus invading their privacy. Additionally, they felt access to the internet was a challenge, so they preferred in-person activities in terms of feeling a connection with others. These 6 themes allowed us to assess the social-emotional needs of local LGBTQ youth. In terms of identity-specific needs, we found that there were differences in TGD youth needs compared to sexual minority-based need. These differences included a desire for non-binary exclusive spaces, promoting cultural competence in educational settings, and resources for gender-affirming care. Sexual minority youth felt underrepresented in subgroups like ace and bisexual identities and sought greater representation. With these themes in mind, based on our findings, we shared and suggested that TransPonder hold identity-specific groups to encourage more engagement in local activities, provide inclusivity training for providers so they may deliver appropriate resources to these youth, and have multiple forms of accessibility to resources, including more advertisement for activities via social media, specifically Instagram. While this assessment primarily focused on the needs of LGBTQ identifying individuals, findings also provided insight in future directions with other marginalized communities in need of accommodations, racial and ethnic representation, and people with different abilities. Thank you so much for listening to my poster presentation. I hope you have a great rest of your day. I would also like to acknowledge the McNair Scholars Program, Psychology Honors Program, and the College of Arts and Sciences, the Youth Empowerment Project Lab, and TransPonder for your contributions to this research and community-based needs assessment.